thank you for including me in this very important and very interesting conversation. I think, Rudiger is being a little bit humble about the Geneva Charter. To my mind, it really includes what I think is sort of a tectonic shift in how we think globally about safeguarding human health. And I want to emphasize the first of the principles that he mentioned, which is to value, respect, and nurture planet Earth and its ecosystems. The Charter starts out saying that a healthy planet is essential for the health and well-being of current and future generations and for enabling all to flourish. Essentially, a statement from the world's preeminent health organization that we can no longer effectively safeguard human health without protecting our natural life support systems. And this represents, I think, an important recognition of the critical importance of this emerging field of planetary health. And the main insight of the field of planetary health is that the Earth crisis that we are all experiencing is now precipitating a global health and humanitarian crisis. So the Earth crisis includes the climate change that we're all aware of, but also biodiversity loss, global scale pollution of air, water, and soil, deforestation, degradation of our oceans, all the ways that our collective activities are transforming our planet's natural systems and really degrading those systems. The last several decades of history have seen what Stefan and his colleagues have called the Great Acceleration, this sort of extraordinary ballooning of humanity's ecological footprint. And it's really hard to overstate the size of the impact that we are now having on our planet's natural systems. So every year, in order to feed ourselves, we use about 40% of the entire terrestrial land surface for croplands and pasture. We use about half the accessible water on the planet, mostly to irrigate our crops. We fish 90% of monitored fisheries at or well beyond maximum sustainable limits. We've cut down around half the temperate and tropical forests in the world. We've dammed over 60% of its rivers, and that number is on its way to about 92% over the next few decades. We're suffering from this growing problem of air, water, and soil pollution, and all of these ways that we are transforming nature are driving species extinct at about 1,000 times the baseline rate. We've seen the population sizes of mammals, birds, reptiles, amphibians fall by about 2/3 since 1970. So our collective activities are transforming nature. The core proposition of planetary health is that the size of humanity's ecological footprint now really exceeds our planet's capacities to provide the resources that we're using or to absorb our waste. And as a result, we're transforming all of these systems, not just the climate system, and that those changes in natural systems are interacting with each other in complex ways to affect the really core conditions for human health and well-being that Rudiger is talking about: the quality of our air, the quality of our water, the quality and quantity of food that we can produce, our exposure to infectious diseases, even the habitability of the places that we live. And so we're seeing impacts now across every dimension of human health. And let me give you just a few quick examples from the really rich database of science that's being generated within the planetary health community. We know that more extreme storms, sea level rise, and the erosion of coastal barrier systems, things like vegetated dunes, coral reefs, mangrove systems, that sort of triple threat is actually causing displacement and major risk to about 600 million people who live within 60 miles of the coast and at less than 30 feet above sea level. We're seeing right now today about 1/3 of Pakistan underwater from these extreme floods with enormous consequences for health and the health crisis that we're reading about today around water quality and displacement in Pakistan. And we've been seeing this picking up and accelerating over the last several years in real time. Infectious diseases are changing. We're seeing malaria moving higher in elevation in places like the East African highlands. We're all experiencing the coronavirus pandemic, which is sort of another example of spillover from wildlife populations into human populations, associated in many instances with exploitation of resources, with agriculture, with mining, et cetera, et cetera. It's not only changing temperatures and more extreme weather events and climate-related phenomenon, biodiversity loss is affecting our health. In my own research, we see that a reduction in insect pollinators is meaning that we can't optimize the yields of foods like fruits, vegetables, and nuts that protect us from things like heart disease and stroke and certain cancers. And we've just submitted a paper showing about 500,000 excess deaths a year because we don't have enough pollinators around to produce the healthy foods that we depend on to protect us from those diseases. We've also shown in our work that adding carbon dioxide to the atmosphere actually changes the composition of the crops that we grow and leads to reductions in things like iron and zinc and protein that are really important for human health, pushing hundreds of millions of people around the world into new risk of deficiency from those nutrients. So I could go on and on for 2 hours about these health effects, but they are extensive and they affect every dimension of human health. When we think about who's vulnerable to these health effects, consistently what we find is that the poorest people in the world, those who can't afford seawalls and air conditioning and bed nets and can't access markets to purchase crops when prices go up, it's always the poorest people in the world who are at highest risk. It's always future generations where these risks start to magnify. And it's all the other species on the earth that have very little capacity for adaptation. So it's important to highlight the justice dimension of this conversation. So when we think about this problem, what really becomes clear is that our core problem is simply the size of humanity's ecological footprint. And if we want to address that problem, unfortunately, we need to think about how we're living on Earth, and we need to think about what we call a great transition that includes shifts in how we produce energy, how we produce food, how we design and live in our cities, a major shift in how we're living on Earth. And what this really means, I think, is that we need to see sort of an expansion in how health policymakers think about their job to include the protection and regeneration of our planet's natural system. So 3 sort of concluding points. 1, the Earth crisis is precipitating now a global health and humanitarian crisis. 2, we can't effectively safeguard human health into the future without stabilizing and regenerating our natural life support systems. And 3, we need to live differently to achieve that stabilization and embrace this great transition, which will mean working much more closely across disciplines that have historically been siloed. Thank you so much.